If you have epilepsy and undergoing epilepsy surgery, you need an MEG to guide the surgery process.
Omar, thank you very much for joining us today. Could you tell us a bit about yourself and what got you into neurology, but more specifically epileptology?
Thank you so much for inviting me. I was fascinated by the brain early on when I was in the medical school, and seeing neurological conditions attracted me even more to kind of apply what I learned in medical school and the neuroscience research I was doing into the brain and treating it. And honestly, I saw a massive amount of patients with epilepsy that there is a huge treatment gap, that they are not getting enough treatments and enough diagnostics and enough breakthroughs. So I tried to dedicate my life and career to helping people with epilepsy navigating through their condition.
That's lovely. And also, when you help people with an epilepsy, you're not solely helping the individual with the diagnosis, are you? But you're helping their family. Because it so often affects them.
Yes, epilepsy is more than just seizures, and epilepsy affects the person and can affect their families and their communities. So when we help people with epilepsy, we should take a comprehensive approach and caring for them collectively with their seizures and all the other symptoms other than seizures that they might have. They might have cognitive issues, they might have driving issues, school, disability. All of those things can play a role and can be major contribution to their care. So if we take a comprehensive approach, we will help everyone with epilepsy and their families and communities.
Oh, that's so lovely, because I know lots of clinicians, especially if they don't specialize in the epilepsy, they think epilepsy is just seizures. And it's so not the case. Are you an adult specialist, or are you pediatric?
Yes, I specialize in adult epileptology.
We were going to talk about, and I'll probably say this wrong, and I'm going to read it from my phone, right? So magnetoencephalography, or MEG. Can you tell us a bit about your work with the device and how that can help patients, please?
Yes, so magnetoencephalogram, or MEG, is a quite unique device. So the conventional EEG, the electrodes that we put on the brain and record, it tests the electrical activity of the brain. However, any wire that has electricity, there will be a magnetic field around it, and this is exactly what MEG device detects. So it will detect the magnetic fields of the brain, and any electricity activity, either normal brain function or epilepsy activity, can be detected by this unique device. And it is super sensitive to the point that it can detect the cells talking to each other and give us a very good information about the brain function.
Very cool. So, and how would you say it differs from, say, an MRI? Because for the past few years, a couple of decades even, MRI has been like the king or queen of, neuroimaging. Would you say that this is better, or?
It's very interesting that the word magneto, it's the similar as magnetic resonance imaging, MRI, but it has nothing to do with MRI. It's completely different device. The MEG, it's a device, it's an antenna that only detects the brain activity, does not give any magnetic field, does not have any magnetic things in it. It's only detected the magnetic activity of the brain. However, we use MRI to acquire a brain imaging. So we scan the brain with MRI and use those images to plot the activity in the brain that we acquired from MEG. So MEG, MRI, completely different. They are not interactive at all. And a magnetoencephalogram, MEG, only detects the magnetic activity of the brain. However, because it is very sensitive, we put the device in a magnetic shielded room, completely isolated from the universe, so that we only detect the brain activity and nothing else. If somebody walks down the hall, this device is very sensitive and very accurate and can detect that activity. So we completely isolated from the world to get an excellent signal from the brain only.
If somebody has an epilepsy or a suspected epilepsy, why would they need an MEG in addition to an MRI?
If you have epilepsy and undergoing epilepsy surgery, you need an MEG to guide the surgery process. So how is that working? So if you have epilepsy, usually it is coming from one spot or can be from multiple spots in the brain, and we need the MEG device to locate exactly with the coordinates where the seizure activity is coming from the brain, so that we can plan the surgical treatment accordingly. And the second thing that we use the MEG for is functional mapping. So functional mapping is that we map the brain functions through this device. So we can do language mapping. We can have language functions coming in talking, and we will tell you exactly which part of the brain that you use when you talk, so that when we plan the surgery, we don't take any part of the brain that is highly functional, like talking, and then you will not be able to talk. Also, we can do a sensory mapping to know exactly where the sensation is. We can do motor mapping, where the movement areas are. We can do auditory mapping. We know exactly where the hearing areas are. And even we can do visual mapping, plot where in the brain we can see things. And those are very important because epilepsy can happen in any place in the brain. And if you have epilepsy in an area, it can affect the function. And usually with people with epilepsy, the function can move to other areas of the brain because it's busy with epilepsy. And this way we can make sure that we know where the normal areas of the brain, and we do not damage them or affect them when we do our surgery.
As I understand it, MEGs are pretty expensive devices, and not many hospitals have them. Even in the US, UK, not many of them exist. Is it down to expense? What is the reason for that?
That's correct. We do not have many MEG centers that we should have. So over the world, we have about 40 centers in the United States that have MEG, 10 centers in the UK, and about 37 in the Europe, and worldwide we have only 140 centers. So this is very, very, very small amount. And we're talking about millions of people with epilepsy that need this service. The limitations are that first, the device itself is expensive. It's between $3 to $4.5 million equipment, and it needs engineering and maintenance. And the most important thing, it needs a highly experienced individual to read the MEG signal and decide what is normal, what is abnormal. So those are the two factors that usually are on the way. But however, those can be easily overcome because it is an investment that we put down, and we can make the device will stay living for a very long time. And also it's easy to train other doctors to read MEG like I did and others are doing. So you can get that done because it is a very valuable service for every patient with epilepsy that is undergoing surgery.
So it could effectively not only literally save more lives because people will get more treatment or more effective surgery earlier, but actually it could also minimize treatment of the future if people get more effective treatment at an earlier date. Is that correct?
That is right, because refractory epilepsy is associated with even mortality. Like people can die from their epilepsy if they are it's SUDEP. So this is very important because we want to save lives, and MEG can help a lot. So for example, there are 10 indications that an MEG can be very helpful that no other machine or other test can do. Somebody has an MRI negative test, so it means that you do MRI, you don't see any lesion or any spot in the brain, any scar.
Right.
You can do an MEG and you can locate where exactly the activity of the brain that you can operate on. It can work with people who have no EEG spikes, and then you do an EEG, you don't see any spikes. You do MEG because it's much more precise, much more sensitive. It can detect the EEG activity. And for people who have multiple lesions, like tuberous sclerosis, have multiple tubers all over the brain, and you don't know which one is the hot tuber, we call it, which one is the tuber that can cause seizures. So we can do MEG and we can look at exactly which tuber is causing the seizure so that we can take it surgically. And sometimes we have a large lesion, like a tumor or a big trauma that cause epilepsy, and you don't know, like, you know that the seizures are coming from there, but you don't know exactly which part of the tumor, which part of the scar the seizures are coming from. And then you can do an MEG, it can locate exactly where this activity is, and many more. So there are lots of indications and ways that it can help. So basically anyone who's doing an epilepsy surgery should get an MEG to help guide that procedure.
So I'm thinking of people right now, after what you've just said, people who have what used to be called idiopathic epilepsy. This could be really useful. Also for people who potentially may have already had surgery and it hasn't been effective, or why might that be, or hasn't been as effective as you might want. And then this could also still be useful for that.
Yes, very important, because once you cut the skull out, during a surgery, that will distort the electricity activity going through the skull, and this called breach artifact, and that will make the EEG very less accurate in localizing where the activity is. However, MRI uses magnetic field, and magnetic fields, if we know some physics, it does not get distorted by any field that is going through, so it goes through the skull very easily. So we use MEG a lot in patients who already had a surgery and the surgery did not work for them, because sometimes there is like a very blurry line between the temporal and frontal lobes, and sometimes you do EEG, it tells you it is in the temporal lobe, and in fact it is not in the temporal lobe, it's in the frontal lobe, so you do the wrong surgery.
Oh my gosh.
It's massive implications if you think about that. So definitely MEG can help. And one of the important things, like we're talking about idiopathic epilepsy, especially the idiopathic generalized epilepsy or juvenile myoclonic epilepsy, it can tell you if the epilepsy is due to a generalized epilepsy from all over the brain, or it is a deep one focus that can be in the frontal lobe, but it shows on the EEG like it's a generalized epilepsy. And this can really differentiate through the MEG system.
So Omar, tell us about your research into MEG imaging and scanning.
MEG is a powerful tool that tells you where the activity in the brain is and the connections and interactions between multiple brain areas at the same time. So with this tool, we can do so much research on any brain and neurological conditions, because it's a tool that is agnostic to any disease, means that it doesn't care what disease process you have, it will give you the information of the brain. For that, we use MEG for so many different conditions to exactly know what's going on, what is the disease process. For example, we test people with Alzheimer's disease and localize where the memory areas are. We can test people with multiple sclerosis and how the brain changes happen over time. We can test people with schizophrenia. We have studies, a lot of studies with traumatic brain injury. So when the brain has an injury, there are changes in the brain, and we can track those changes over time and see how the brain recovers and heals. And we can have biomarkers to understand which brain does recover good and which brain does not recover, all through the MEG. One of the interesting stories we have of the research that we have done here at Henry Ford Hospital is autism studies. So we tested people with autism, and we give them pictures and faces and interaction testing. So what they did with kids with autism, they have lots of occipital activation, means that they just seen the picture. And with other neurotypical kids, like kind of normal other kids who have the same age, when they see pictures, they have lots of activation in the frontal brain, in the frontal, parietal, and temporal. So it's kind of the normal brain will look at the emotions and the connections, but the autistic kids will only look at the back of the head, which is just seeing pictures and not interacting with them. So this was possible because we have done through MEG, and this test is like showing us why kids with autism, they have lack of this social skills and interaction with other people.
And you mentioned schizophrenia, and it's making me think about other mental health difficulties. And for instance, I've seen numerous papers where they show images of a person with depression and a person without depression, and the activity within their brain is significantly different. Have you been looking into that as well?
With depression, yes, the activity, usually there will be decreased frontal function. So the frontal function is where the personality and the control of the emotions happen, and also in the emotional areas in the amygdala and the mesial temporal lobe. So there will be increased activity in the amygdala and decreased activity in the frontal lobe. So that's why like the emotions are more exaggerated, and also this is the same happens in PTSD and other psychiatric anxiety disorders. So there will be exaggerated emotional responses and decreased frontal control over those emotions. So lots of other testing we can do. Like for example, we can work on tinnitus. So this is like buzzing sensation that people have all the time in their ear, and we can map where the tinnitus areas in the brain that are really active at a single frequency, and we can like think about treatments for that and even neurostimulation in that area to kind of suppress the tinnitus and the loud sounds that people are hearing all the time.
Oh my goodness, I want one of these machines like in my back room or something. Like imagine the lives, people's lives that you could improve, and not even solely people with an epilepsy or people, with depression or schizophrenia or whatever, but actually people who don't have a diagnosis in anything. Imagine if you could just put them into one of these, MEG machines and identify abnormalities or differences that were not considered necessarily healthy, and how you could improve those people's lives.
It's a machine and biomarker with so many potential applications in so many neurological conditions that should be even investigated more and focused more on in the future, which we're trying to push the envelope in this field and improve the lives of so many people with neurological conditions.
So the research that you're doing, how is the information applied for individual patients? And so, for instance, when it comes to surgery and stuff like that.
So for surgical treatment, when we have an extra information or where exactly the seizure focus is in the brain, then that will make us have targets for intracranial recording when we're trying to put leads inside the brain. So it's kind of like when you have a seizure on EEG, we'll tell you the seizure is in Europe in the world, like for example, and then and then it's like, yeah, Europe is like large, and then we need to like localize it more, and then the MEG will tell you it is in UK, especially in London. So it's kind of like it will focus really small area and tell you where exactly you should go. So this way we can have more precise surgeries and more precise treatments. Instead of like taking the whole temporal lobe or the whole frontal lobe, we can manage with just taking the lesion or where the seizure starts only, and save all the other areas from damage and memory loss and all the other complications that happen after surgery.
Lots of people obviously at the moment around the world are suitable for instance, a temporal lobe resection. Now, I can imagine lots of people and families watching this, and even clinicians will be like, oh my goodness, well, we need to get that patient, an MEG then, and perhaps not scoop out a load of ice cream or like temporal lobe, but actually be more specific with the leads. But that is not going to be possible for them now. So what would you advise for these people to do?
If it is possible to look around you, I mean, no matter which country you live in or any area of the world, there might be a MEG center next to you, but you do not know about that center. So ask your epilepsy doctor, your epileptologist, where, can we get MEG and can we scan the brain? Because there is possibility that you have a MEG center next to you and you're not utilizing that. And the first thing. And the second thing, if the MEG is completely not available, we can do EEG source imaging, which is much lower quality, but it kind of at least gives you more information than just doing like a normal EEG. You can do high density EEG source imaging, but definitely the MEG is like the best way, and then EEG source imaging will be the second high density EEG if it's utilized.
How long has it been going? How long will the project last? What are anticipated outcomes?
We have been doing MEG studies for over 25 years now in our lab at the Henry Ford Hospital, and we have worked on so many different projects, and usually the project, it can take anywhere between 1 to 5 years, depends on the recruitment and how many cases we are studying. And we are kind of working with other people who are interested in traumatic brain injury to study the biomarkers of traumatic brain injury, especially the minor ones, the TBI, which is concussion only, that does not cause major brain damage, but people are having some sequelae and other effects. And also we're studying the multiple sclerosis changes over time, and this project is running. We expect it to be done by between 1 and 3 years to have the results. And overall, the results are promising. When we do any preliminary analysis, we start seeing signals in one brain area or another that is important for the function. And really, sometimes we discover areas of the brain that we did not even think about being important in this function, but we found that, yeah, it is important. It is part of the network that solves this problem in the brain, and we kind of advance the science this way.
Isn't it exciting? Like your inner child, when you find out things that you were not expecting, and you're like, wow, that's so cool. And then you have to learn how to apply that knowledge, right?
Yeah, sometimes it's kind of scratch your head, oh, why this area is involved in this function. It's you never expected that the mesial frontal lobe is involved in this, solving this problem. But definitely it's kind of a new information, and we look deep in all the functions and the networks, then we say yeah, this makes sense, because now the research in the neuroscience is going from just one area of the brain. It's kind of, the frontal lobe does this, the temporal lobe does this, to more of a network approach. Means that there are multiple areas and multiple nodes in the brain. They're all working together to solve one problem or or fix one issue. And now we're doing network analysis, and that is really how the neuroscience is evolving now.
Yeah. Now, I would just wonder, this is probably going to sound really cheesy, but for people who think network, brain, what are you talking about? If you think about like the hierarchical structure at work or something like that, or like your network on LinkedIn or Twitter or something like that, it is kind of like similar. And you have different people in different areas with different skills, different personalities. And the brain is very much like that, isn't it? Depending upon the lobe and location and usage. Would you say that's like a good comparison?
That's right. So like if I ask you like, I've asked you what is the weather today? And then like this question, it's not like it doesn't go to one area. It goes to the area of the temporal lobe to hear it. And then it will go to the memory area, and it will go to the Wernicke area where it's going to analyze the meaning of the question. And it will go to the Broca area to make the answer, and it will make multiple connections in the frontal lobe, parietal lobe, and occipital lobe even go to the cerebellum. See, like it's one question, one answer. There are so many areas and nodes in the brain that have to contribute somehow to this very simple task. And this is how we understand the brain now. Everything is connected, and all the areas of the brain are part of a network that function and saves information and solve problems this way.
And the more we learn, the more we realize we don't know, right?
That's right, yeah.
But that encourages us to keep going forward and seeking more funding for research. And yeah, I just think it's really, really amazing. And it's that kind of work, the research that you're doing, that really kind of lifts us up, whether we be patients, families, or other clinicians, because we can't do everything. And so to just hear your story is really, really uplifting. So thank you so much.
Thank you. Bye-bye.